Alrighty, good morning everybody. I'm Chloe Pedley. I'm the Health Promotions Team Lead, and I think I've spoken to most of you throughout the weeks leading up to the forum just to have a quick chat. So it's really nice to see some faces in the room, and again, I would like to acknowledge the traditional owners of the land and pay my respects to elders past, present and emerging. We are going to be talking about the liver, your hardest working organ. The liver has over 500 functions. So it produces bile and filters the blood. It regulates clotting. It helps with your digestion and metabolism. It provides immunity. It helps with hormone and energy regulation, and it's a storehouse for nutrients. So one of the things that the liver does, and as you can tell, I'm very perky this morning, it converts carbohydrates into glucose. So that's where you get your energy from. Now, liver disease is what we champion here at Liverwell, and there are several types of liver disease. Obviously, there's viral hepatitis, which we're going to be doing a deep dive into today with other speakers. But who's at risk of liver disease? So people who are overweight and obese, people who drink in excess of alcohol, people who have viral hepatitis B or C, and people who have a problem with their immune system. There are lots of different types of, also people who are born with liver disease. So there's genetic liver disease and autoimmune liver diseases, which we'll touch on in a moment. There are lots of different types of liver disease. One of the most common liver diseases in Australia and worldwide is fatty liver disease. So fatty liver disease is where fat accumulates in the cells of the liver and builds up, causing stiffening, hardening, and then eventually scarring and potentially liver failure. It has the sneaky trick of going undetected. So unless you've been tested for fatty liver disease, you may not actually know you have it. It can affect people of all weights, shapes, sizes, and lifestyles, but you're more at risk if you're overweight and obese or drink in excessive amounts of alcohol. Then we have alcohol-related liver disease, which is caused by excessive drinking. Now, the great thing about alcohol-related liver disease is it can be managed in general practice, and if it's detected early, it can be reversed. And then we have NAFLD, so non-alcoholic fatty liver disease. So this is fatty liver disease that's not caused by alcohol. It's got a funny name, but it's actually quite a serious disease. NAFLD is the most common form of fatty liver disease. It's caused by a diet high in processed foods, so carbs, sugars, fats, and salts. And again, with changes to your diet and your exercise regime, NAFLD can be managed and potentially reversed. Then we have non-alcoholic steatohepatitis, which occurs when the liver becomes inflamed in advanced stages of NAFLD. It's associated with obesity and diabetes and all elements of metabolic diseases. Finally, we move on to viral heps. So today we're going to be talking about viral hepatitis B and C specifically. They are caused by the hepatitis viruses B and C. And then at late stage of any liver disease, we have liver cirrhosis. So that's when, if inflammation is left untreated, the liver cells can die, leading to scarring, called fibrosis, and then eventually the blood flow stops, which is cirrhosis. After that, the unfortunate consequence of untreated liver disease can be liver cancer and eventually liver failure. And I would be amiss if I didn't talk about genetic and autoimmune diseases. So they're very rare, but people can be born with liver disease, and people can acquire autoimmune diseases where your immune system attacks your liver cells. So hepatitis is a global problem, and what I'd like you to take away from these slides is that 1.34 million people die from viral hep every single year, and that far eclipses both AIDS and malaria. And I'm not sure if you're aware, but AIDS and malaria get a great deal of attention and a great deal of focus in terms of health promotion. A lot of you are in this room today because you wanted to learn about viral hepatitis, and you may not have heard much about it to date. And that's something that we at Liverwell are working very hard to change. So in Australia, and to bring the problem locally. 340,000 people are estimated to be living with hepatitis B and or C, and Jen and Nafisa will be touching more on this in depth in their epidemiological overview. And it's estimated that 200,000 fewer people are receiving hepatitis treatment and screening compared to the number in 2020. And this, unfortunately, was due to the pandemic and people being forced to stay at home. So we've seen a decline in the screening numbers as well. And there we go. So what is hepatitis? It comes from the Greek word hepa, meaning liver, and titus, meaning inflammation. So there are lots of different causes, which we touched on in the previous slide: alcohol consumption, viral, the virus, some chemicals, drugs and medications, fatty liver disease, and autoimmune disease. For most people, and this is really important, hepatitis can be asymptomatic. So you don't know that you have it unless you've been tested for it. The disease is a sleeping disease. It lingers in your body for even decades before it's detected. And by the time that you're symptomatic, it's quite often too late or at late stage of the disease. Hepatitis B, which is what I'm talking about today, is a very old virus, and approximately a third of the world's population has been exposed to it or infected at one point during their lives. So, who is at risk? And there is a great big long list of who is at risk. And that is people who use or who have ever used drugs, babies of mothers who are infected with hepatitis B, migrant and refugee communities, especially from the Asia-Pacific region, the Middle East and Sub-Saharan Africa, Aboriginal and Torres Strait Islander people, men who have sex with men, people with multiple sexual partners, people who inject or who have ever injected drugs, sexual and household contacts and family contacts of people living with hepatitis B, sex workers, health professionals who perform exposure-prone procedures. So if you're working with blood products, you're at risk of contracting hepatitis B. And hemodialysis patients and people living with hepatitis C or HIV. And then finally, people with blood transfusions prior to 1990, which is prior to when we screened for hepatitis B in blood products. And people who engage in unsterile tattooing, which for some young people particularly has become quite a trend because you can buy tattoo guns off eBay, and unsterile tattooing has become something that we're seeing in our communities now. There is acute versus chronic hepatitis B. So acute hepatitis B can last up to 6 months. In adults, we tend to clear the virus. 95% of adults will clear the virus spontaneously. In children, 10% of children will clear the virus spontaneously, and the other 90% will go on to develop chronic hepatitis B, which is a lifelong infection and quite often needs treatment. So hepatitis B is a blood-to-blood and sexual fluids transmitted virus. It's transmitted from the blood of a person with hepatitis B entering the bloodstream of a person without the virus, or through unprotected sex. Sexual fluids into blood only, or the most important one, which Nafisa is going to be talking about in her presentation today, is mother-to-baby transmission. There are 3 tests that you need to get at your GP to establish whether or not you have been exposed to, have a current infection, or are immune to hepatitis B. So that's the surface antigen test, the core antibody test, and the surface antibody test. And as you can see from the slides, they each tell you whether you've been exposed and have a current infection, or are immune to the virus. So the fantastic thing about hepatitis B is that we have a vaccination, and that's been offered to all babies since the year 2000. 4 doses are required for immunity at 2, 4 and 6, 0 at birth, 2, 4 and 6 months. For adults, there is a big cohort of people who obviously have missed out on that hepatitis B vaccine if you were born prior to the year 2000. So there are adult vaccines available, and it's a 3-dose vaccine. You can be tested, and you should be tested before getting vaccinated to see if you've been exposed to hepatitis B, have a current virus, or are immune to it already. And a month after the completion of the vaccination doses, you should have a quick blood test to make sure that the vaccination has taken and that you're immune to it. There are also catch-up doses and booster vaccines if needed. So then we move on to managing and monitoring hepatitis B. So the current antiviral treatments do not cure hepatitis B completely. However, they are very effective in suppressing the virus. The medication used to achieve viral suppression is entecavir and tenofovir. They are commonly prescribed and very effective in terms of viral suppression. The hepatitis B infection needs to be monitored every 6 months, and the monitoring process is no longer biopsies and invasive treatments. It's blood tests, liver ultrasound, and a baseline fibre scan, which is a little bit like an ultrasound. And with that, I wrap up my hepatitis B presentation, because we're going to have a deep dive into it with Jen and Nafisa's presentation and the case studies and discussions later on in the forum. If anyone has any questions, please feel free. If not, I'm going to hand over to Pearl, who's going to talk about hepatitis C. Yes?
Can I ask the stats for Australia? Were they for world population or were they for Australia?
So in Australia, it's 270,000 people are estimated.
Yeah.
Yeah, so 270,000 people are estimated to have hepatitis B in Australia. So it's a large number of our population. Approximately 70% of those people don't know that they have the virus or are not receiving care, and only 10% of people living with chronic hepatitis B are getting antiviral treatment. So we estimate that that's about half the number that should be getting the antiviral treatment. Yeah.
And these are the stats that were released from the World Hepatitis Day
Speaking
event.
to the mic.
Sorry. So these were the stats released by Hepatitis Australia last year based on their numbers. But Jen and Nafisa would be doing a deep dive into the numbers.
Yeah. Yes.
Just regarding the monitoring of the 6 months, is that for the length of their life? Can that be done by a GP or is it?
So monitoring can be done in general practice, and it is a lifelong procedure. So you want to be checking in every 6 months if you require treatment for hepatitis B. Do you want to touch on that as well?
Just to add to that, if the person has like a comorbidity like diabetes or any other underlying sicknesses, then they would be referred to infectious disease specialist or a hepatologist to manage it.
Thank you so much. Pearl, it's all yours.
Sorry. Hi everyone, welcome. I'm Pearl, the Health Promotion Knowledge Officer at Liverwell, and I'll be talking to you about hepatitis C, and we'll summarize the presentation. We'll also look at a bit about COVID and its impacts on hepatitis and liver health. So with hepatitis C, it is a blood-borne virus that causes inflammation of the liver. And like Chloe mentioned, with hepatitis B and C, if not diagnosed in time, it can lead to progressive liver disease and liver cancer. So more than 60% of Australians living with hepatitis C remain untreated. In Victoria, more than 40,000 people are currently living with hepatitis C. In terms of who is at risk of hepatitis C, the list is quite similar to what we heard from Chloe with hepatitis B, but we'll quickly do a brief overview. So we have people who inject drugs or have ever injected drugs. So they make up 90% of our new hepatitis C diagnosis and 80% of our existing hep C diagnosis. We have people who've ever been in prison or in custody, incarcerated people. Mother-to-baby transmission is actually quite low when it comes to hepatitis C. We'll look at in the upcoming slides why that is. We also have recipients of blood products prior to 1990, and this is because the test for screening for hepatitis C was introduced after. And we have contaminated or inadequately sterilized instruments and medical or dental procedures done overseas where adequate infection control measures might not be in place. Also, people who've migrated from endemic regions of hepatitis C, like Southern Europe, Asia Pacific, and Africa. And Aborigine and Torres Strait Islander people are also 10 times more likely to be diagnosed with hepatitis C compared to the non-Indigenous population. So, why is it important for us to look at hepatitis C, and why is it still such a public health challenge for us in Australia? And this is primarily because if we look at the way the infection progresses, it actually starts with an acute stage, which is fairly asymptomatic, and a lot of people don't feel sick, or even if they do, the symptoms resemble other common ailments, so it might be passed off and people might not be taking themselves to a doctor to get screened on time. So about 25% of people who get acute hepatitis C, which is infection that lasts in your body for up to 6 months, about 25% of people would actually clear it spontaneously on their own. And research actually shows that women clear acute hepatitis C infection. They have higher rates of clearances compared to men. And this is because of, just a side note, this is because of the hormone estrogen that helps maintain liver health. And about 75% of people with acute hepatitis C, they won't clear the virus spontaneously. So they will go on to develop what is the chronic hepatitis C infection, which is any infection that lingers in your body beyond 6 months. So again, people with chronic hepatitis C might not feel sick at all initially, so they won't have symptoms. But if the liver damage, if the disease is left undiagnosed and it's allowed to progress, it'll go on to develop fibrosis, then cirrhosis, and eventually you'll have hepatocellular carcinoma, liver cancer, end-stage liver disease, and eventually you'll need a liver transplant. And if that is not in order, then the person can also die. So the progression of liver disease actually varies, and for the infection to get really serious and come to liver cancer, it takes roughly about 25 to 30 years, and about 20 to 25 years for cirrhosis to develop. But that said, the progression of infection will vary from person to person, and this is because of other factors like the age the person gets diagnosed, the genotype of the infection, and even their own lifestyle habits like their alcohol and drug intake. So transmission, these are routes that are actually common to both hepatitis B and C. And like Chloe mentioned, there is blood-to-blood transmission, which means the virus has to enter from an infected person's bloodstream into another healthy person's bloodstream for the virus to establish that transmission route. And so we'll look at some of the common routes of transmission here. We'll look at sharing injecting equipment. So injecting illicit drugs and sharing the equipment is the most common transmission route for hepatitis C. And in Australia, as I mentioned before, 90% of our diagnoses are from people who inject drugs. And it's not just the needles that people share that are able to transmit the virus. It's also the other equipment like the tourniquets, the swabs, filter, spoon, the water that people might be sharing. In terms of sharing snorting equipment, again, so the membranes inside our nasal cavity, they're quite delicate. And sometimes snorting practices might damage those membranes, and there might be potential blood-to-blood contact. And when you're sharing that equipment, there is that transmission route established there. In terms of unsterile tattooing and piercing, any scarification process that involves contact with blood, and you can have that transmission route there again, which is why Chloe mentioned right now we have a lot of backyard tattoo practices, so that is another way that transmission route is established. We'll move on to sharing grooming items. So people with hepatitis B and C are recommended to have their personal household items, grooming items like razors, nail clippers, toothbrushes, or any item where there is the possibility of nicking yourself and exposure to blood. In terms of workplace exposure, the risk is lower as compared to the other ones that we've discussed. Same goes for sharing grooming items. So workplace exposure, I'd say the risk is intermediate, approximately 6% when it comes to needle stick injuries. And There are other factors that play in here. You have to look at the depth of penetration, if it's a needle stick injury, the size of the needle, but it is recommended that health workers are vaccinated against hepatitis B and A. Now, finally, mother-to-baby transmission for hepatitis B is quite high, and Nafisa will be speaking to that. But for hepatitis C, the risk is quite low. It's 5 to 6%, but it jumps to 36% approximately if the person is also co-infected with HIV, if the mother is co-infected with HIV. And this is because research shows that the virus does not easily pass through the placenta during pregnancy. So in that instance, it cannot get transmitted during pregnancy. The only risk of transmission is during delivery, when there is exposure to the mother's blood. So this slide is basically to summarize ways by which the virus will not get transmitted. So mosquitoes, fleas, ticks, they cannot transmit the virus. Neither will sharing food or utensils, holding hands, kissing, using public toilets, and breastfeeding will also not transmit the virus. The only caveat with breastfeeding is if the mother has cracked nipples, then it is advised that she hold off on breastfeeding and speak to her healthcare provider. So we've looked at the various transmission routes, and with hepatitis C, it's still a challenge because we don't have a vaccine. So we have to look at other ways we could prevent and break that transmission cycle. So needle and syringe programs, we know that they're important because our high-risk groups here would be people who inject drugs, so it's important to give them the support they need, encourage harm reduction practices. So it's important for people to know where they can access these services. In terms of education, it's mainly to do with raising awareness, busting those myths and misconceptions about transmission, and it's the reason why we are here today, to raise awareness about the virus and break the stigma and discrimination faced by people living with viral hepatitis. Now, treatment as prevention. So this is a principle that's been talked about, and I'll provide a brief overview about it. So this ideology basically states that if we treat enough people living in the community with hepatitis C, if we treat enough people, then we would drive down those infection numbers and reduce the risk of transmission between community members. In terms of universal precautions, treat every person as infectious. So this statement has several nuances. In the healthcare setting, we have a lot of people living with hepatitis. They might not want to disclose their status, and this is because of the stigma and discrimination they may have faced in the past. So it's important for us as healthcare professionals to follow the adequate infection control procedures and take the adequate precautions for each and every person and not discriminate between them based on their viral status. And in terms of the other situation now would be following infection control practices, which I think with COVID we already do. That is proper hand hygiene, wearing PPE, routine environmental cleaning, proper disposal of blood and body fluid samples, etc. We'll quickly look at testing and diagnosis. So as Chloe mentioned, the only way to find out whether you have the virus is to get a blood test, because even with hepatitis C, 1 in 4 people do not know they have the virus because there are no symptoms. And the way to test for hepatitis C is to get a blood test, and it involves 2 tests. The first test is primarily a screening test called the antibody test, and it tells you whether the person has ever been exposed to the virus, and it screens for the presence of the viral antibodies. And this test can be performed, it has a window period of 3 to 6 months, and presence of antibodies does not actually mean that you have immunity to the virus, and we'll look at why that is with hepatitis C in the next slide. But also, earlier I mentioned that 25% of people with the acute infection would clear the virus spontaneously. Those people would still test positive to this test. So they would test positive to the antibody test because they would have the antibodies lifelong. So if this test comes back positive, you would need to do the second test, which is the polymerase chain reaction test. And this test confirms, it looks for the presence of the viral RNA. So it confirms if you have a current infection. So this can be done about 2 to 6 weeks following suspected exposure. And it actually gives you more information in terms of testing. It tells you the genotype of infection of the virus. It can tell you the viral load circulating in the person's body. And often from our infoline information system, we hear that a lot of people don't get the second test, which is actually the most important test. So a lot of people get the first test, they might have tested positive, and then they're lost in the system. They're not really followed up about the PCR test. Now, if there's reason to believe there's also significant liver damage, some liver function tests may be recommended. A fibroscan, which is like an ultrasound imaging for your liver, might be recommended to screen for liver scarring and stiffness. Now, we'll speak about treatment, and the rate of treatment uptake has declined steadily since 2016. We'll look at the stats in a bit with our upcoming speakers. So pre-assessments are performed to determine the best course of treatment, and here the treatment we'll be talking about are the new treatments. Not exactly new, they've been around since 2016, but they're not talked about as much, so the direct-acting antivirals. But the pre-assessments performed are basically virological assessments, and they look at past history of hepatitis C infection, they look at other co-infections that you might have, whether you're co-infected with HIV, they look at the extent of liver damage, and once they screen all of that, they would prescribe the best course of direct-acting antivirals. So before we jump onto these miraculous drugs and talk about them, I'll talk a bit about the old treatment, which is the interferon therapy. And this therapy was like chemotherapy with the antiviral drug called ribavirin, and it actually had a lot of harsh, troublesome side effects, and it was usually recommended as a last resort. And also, it wasn't recommended for people with mental health issues because it was linked to high incidences of suicide. So it was pretty harsh, the older treatment that we had. And now with the new treatment, the direct-acting antivirals, they've been available since 2016, and they have a very high success rate, more than 95%, and side effects are very mild and very rare, and the side effects include headache, nausea, tiredness. And they're also available subsidized on the Australian Pharmaceutical Benefits Scheme. So the treatment is just pills taken daily for 8 to 12 weeks, sometimes 24 weeks, depending upon your pre-assessment. And the commonly prescribed drugs include Epclusa, Maverat, and Harvoni. So I've included a bit of an overview about maternal and child health screening and treatment, because our other speakers will be talking about hepatitis B. I thought we could touch upon hepatitis C in our starting presentation. So women contemplating pregnancy or seeking antenatal care should be made aware of the benefits of screening for hepatitis C, because it isn't provided as part of routine screening for pregnancy in Australia. And the testing provided should be done with informed consent, it should be voluntary, and other considerations, just in our discussions and our daily dealings with the community, other considerations would be in terms of relaying the results of those tests, we need to be mindful that women don't face discrimination or stigma from their partners, relatives, friends. Then we move on to the next point, which is there is lack of proper safety data for use of the DAA drugs that we talked about earlier, and so they're not recommended for use during pregnancy or lactation. And women are usually offered the hepatitis C treatment after they complete breastfeeding, and this is to reduce the risk of progressive liver damage that's already existing if they are living with hepatitis C. And lastly, infants born to mothers who are hepatitis C positive should be tested at 12 to 18 months of age or after. And the DAA drugs are actually available for children 12 years and above, and they're subsidized on the PBS. So a little more about the hepatitis C treatment. In terms of eligibility, anyone can access these treatments, whether they're injecting drugs, whether they're on a rehabilitation program, or they're consuming excessive alcohol. So it's available to everyone, and it usually works quite well, even if you have significant liver damage. In terms of restrictions, the only restriction with the treatment is that you can't take them if you're pregnant or breastfeeding. And birth control is recommended for people who are prescribed these medications 6 months before and after. Barriers to treatment and supporting clients. So the common barriers we've come across would be competing priorities with alcohol and drug organizations. You have your systemic barriers, structural barriers, and competing priorities again with that as well. There's misinformation about eligibility and the cost of the treatment, and also the stigma and discrimination that people face when they're accessing healthcare. In terms of clearing the virus, so there is a test to detect if you've cleared the virus after you've taken the direct-acting antivirals, and this is called the SVR test, or the Sustained Virologic Response Test. It's done 3 months after someone completes their hepatitis C treatment, and it screens for the presence of the viral RNA. If this test comes back positive, it means that the person has successfully cleared the virus. Monitoring for hepatitis C. So earlier I mentioned that antibodies to hepatitis C don't mean that you're immune to the virus, and this is because hepatitis C actually has several genotypes or strains. So you might get one genotype and clear the virus and get reinfected with a different genotype. In Australia alone, we have 6 different genotypes, so it is possible to get reinfected, especially if people are engaged in risk-taking behaviors. But the good news is you can keep accessing the treatment. There's no cap on the number of times you can access the treatment. Okay, so I've come towards the end. We'll talk a bit about COVID-19, hepatitis, and liver health. So liver being the chief metabolic organ, it has faced a few side effects from viral infection in the body. Some people with COVID-19 have reported abnormal liver function and liver injury. Also, people with pre-existing liver conditions, Chloe talked about earlier fatty liver disease, NAFLD, they're also known to develop poorer health outcomes following COVID-19 infection. Hepatitis screening and treatment uptake has been affected by COVID-19, especially in the harder hit states like New South Wales and Victoria. We've seen a drop in screening and treatment. And lastly, it is important to encourage self-care and address lifestyle factors. And at Liverwell, we have developed 4 lifestyle guides on eating well, getting active, feeling well, and being drink-aware. And if you're interested to look at them, you can jump on our website, and they're available under the resource section. To summarize the presentation, so there's still significant rates of hepatitis hepatitis B and C in Australia. Both have an acute and a chronic phase. There is an effective vaccine for hepatitis B. Currently, we still don't have a vaccine for hepatitis C, hopefully in the future. There are effective cures for hepatitis C with a very high success rate. Thank you for listening. And you can call us on the Liver line, you can email the address provided, you can visit our website, or you can come meet us in the office in North Melbourne. Thank you.